What's really the situation on the ground? Let's give you a reality check from ground zero. Take a look.
Angry relatives of a COVID patient came to blows with the administration at a Mumbai hospital. They allege that the patient died due to lack of oxygen and that the hospital did not inform them that the supplies are running low. With the COVID cases surging, the state of Maharashtra is sending out SOS for oxygen.
मला कल्पना नाही असं करता येणे शक्य आहे का? असेल तर आपल्याला लष्करी तज्ञांची मदत घेऊन जर हवाई वाहतुकीने आमच्याकडे ऑक्सिजन आणू शकलो आपण आणि आणू शकत असू तर कृपा करून आम्हाला नुसती परवानगी नाही तर एअर फोर्सला सांगून आम्हाला मदत करायचे तसे आदेश द्या. एवढी निकड आता आपल्याला ऑक्सिजनची लागलेली आहे.
Maharashtra required close to 200 metric tons of oxygen on a daily basis. But does the state have enough? And what is the situation on the ground? Imran Sheikh has been struggling to get an oxygen cylinder for his relative in Pune. He was told by the Ojas hospital authorities to arrange a cylinder himself.
मेरे रिलेटिव को ऑक्सीजन लगा हुआ है तो उसका भी ऑक्सीजन ख़त्म होने को आया है तो मैंने अभी नर्स को बोला हो कि ऑक्सीजन अभी ख़त्म होने को है और उसको ऑक्सीजन लगाने गए तो नर्स बोल रही है कि मैंने तो 2-3 जगह ट्राई किया है अभी ऑक्सीजन का किधर भी नहीं है हम कोशिश कर रहे. अब उनकी जो बात से ना अभी हमारा ब्लड प्रेशर बढ़ रहा है कि अब आगे क्या होगा.
Others have been running from pillar to post looking for an oxygen bed in the city. Oxygen suppliers are struggling to meet the demand. Some private hospitals are asking for 500 cylinders a day.
शासनाने मदत करायला पाहिजे उच्च स्तरावरती कारण या डीलर लोकांना किंवा हॉस्पिटलला त्रास होऊ नये. रात्रंदिवस कष्ट करून एकतर आधीच आमची अवस्था बिकट झालेली आहे. परत डॉक्टर लोक खूप पॅनिक आम्ही पण पॅनिक खूप होतो. याच्यात रात्रंदिवस झोप नाही येत. फोन प्रत्येक वेळी वाजतात भरून येते गाडी भरून येते गाडी.
In Ahmednagar district, the daily demand ranges between 50 to 70 tons of oxygen. But the supply is around 15 tons only.
तो लिक्विड भरा काय में जाएगा और नहीं मिलेंगे तो हम सप्लाई काय में करेंगे. और ये तो पॉसिबल नहीं है कि हर जगह अलग-अलग लाइन लगा के टैंक लगाई जाए.
Nagar district has reported more than 1 lakh positive cases till date. Some patients have lost their lives due to lack of oxygen.
डिस्ट्रिक्ट में 4 रिफिलर्स है तो प्राइवेट हॉस्पिटल वो उनका फैसिलिटेशन करके वो ऑक्सीजन सप्लाई करते हैं. डेली का जो रिक्वायरमेंट है अल्टरनेट डे टैंकर आता है और डेली का अभी का रिक्वायरमेंट जो था पहले 3 दिन पहले 7 केल का था अभी 10 केल तक गया है. टोटल टैंक की कैपेसिटी 20 केल की है.
The worst is not over yet for the state of Maharashtra. With Pankaj Khelkar in Pune, Bureau Report, India Today.
And to just put all of this in numbers, just let's give you India's COVID crisis numbers at the moment. Active cases are 13,65,704, the second highest in the world. Cases in the last 24 hours, 1,84,372. That's again a new high. Deaths in last 24 hours, 1,027. And I want to focus a moment on that figure of deaths because the fact is crematoriums are overflowing in certain parts of the country and there are serious question marks over whether the deaths are being underreported. This is a problem that stretches from Gujarat to Delhi to Chhattisgarh to Madhya Pradesh. Are the state authorities underreporting deaths? What's the situation in crematoriums? Here's the next ground report.
Long queues at crematoriums, bodies burning on pyres non-stop. In burial grounds, JCBs are digging endlessly. In Gujarat, Surat, the scenes are gut-wrenching. Graves being dug in advance to cope with the bodies of COVID victims.
पहले हम जो है कि कब्रें जो हमारे आदमी यहाँ के जो स्टाफ है कब्रिस्तान का वो खोदते थे जबकि 1-2 मृत्यु आती थी यहाँ पे दफन विधि के लिए. लेकिन अभी कोरोना के वजह से जो मृत्यु का जो रेशियो है ये बढ़ गया है तो अभी फिर हमने एक कब्र खोदने वाले आदमी हमारे नहीं थके और ये काम करते रहे तो हमने 25 से 30 कब्रें जो है JCB से खुदवा के रखी है.
It's not just Surat that is seeing bodies pile up. are pictures from Delhi's Nigambodh Ghat. Several bodies being burnt together, many more waiting to be cremated. The line of ambulances with dead bodies grows longer as the hour passes.
हमको 3 घंटा हो गए यहाँ क्रियाक्रम हो रहा अंदर हम अभी निकल कर आए हैं बाहर से अंदर से भी बाहर आए निकल के जैसे मतलब लाइन लगती है पर्ची कटती है हाँ वहाँ पे बहुत टाइम लग गया था
लाइन लगी थी वहाँ पे कितना टाइम लग गया
कितना टाइम लगा था वहाँ पे 2 घंटे करीब लग गए
मेरे पास 6 फर्नेस है ना 6 फर्नेस है मेरे पास अगर मेरे पास 10 होती 12 होती तब तो कोई वो दिक्कत नहीं आती 6 फर्नेस में एक बार में 6 ही बॉडी का संस्कार हो सकता है और वो 2 घंटे में खाली होती है तो 2 घंटे कोई वेट नहीं करता तो उसे फिर हम वुडन में करा देते हैं उन्हें वेट नहीं कराते
The ITO burial ground is facing a space crunch. JCBs are operating round the clock to create more area for burial.
हमारे यहाँ जैसे कि 17-18 डेड बॉडी रोज आ रही हैं कल भी 17 आई थी उससे पहले 11 आई थी उससे पहले 9 आई थी और आज भी तकरीबन हमारे पास 11 की खबर है और 8 हम दफन कर चुके हैं अभी तक।
In the last 4 days, Delhi has seen 240 deaths due to COVID-19. 81 on 13th April, 72 on 12th of April, 48 on 11th April and 39 on 10th of April. With deaths mounting daily, the fear is that relatives may not even find space to bury their dead.
The question is, once again, we have reached the same situation that we were facing in the year 2020. But now we are running out of space. And the government will have to take some decisions that will lead to stricter measures being taken for COVID-19. With Ajay Thakur, Milan Sharma for India Today.
Let's raise some very big questions right away. Second wave, is it much more dangerous now than the first? Will it only get worse in the next month? What's the best way to tackle this second wave? I'm joined by 2 individuals who've been researching this and are highly regarded. Professor Bhramar Mukherjee, Department of Epidemiology at the Michigan University, joins us. Dr. Ravi is one of the country's leading virologists, been actively involved with tracking this double mutant. Appreciate both of you joining us. Dr. Ravi from Bengaluru. Professor Mukherjee, to you first. We've just recorded 184,000 plus cases in a single day. What's your sense? This is a new high. Will it get worse? Will we now start clocking 2 lakh plus cases and even more in your view in the next fortnight?
So thank you for having me on the show. And it's really hard to watch these reports coming from all over India. And I feel like a year of work has gone to complete waste for many of us. So I do think that the prediction models that we have are forecasting that the next 4 weeks are going to be hard for India. April is the cruelest month, and most of the models predict that within 4 weeks there will be 5 lakh daily cases, 25,000 hospitalizations, and 3,000 to 4,000 deaths every day. And this is deeply concerning. And I hope that there is something done so that these dire model projections are beaten by policy, public health, and public cooperation and collaboration with the government.
Can I just ask you, this predictive model that you're saying, is this based on the virulence of the existing strains that now are prevalent? On what basis are you predicting that we could actually reach 5 lakh cases a day in the next month?
And that's an excellent question. We have such paucity of reliable data about the prevalence of the variants across the states. So the models have to work under a lot of assumptions. So and this is not just our model. We ran many models, the one model from the Imperial College London, another model which takes into account of underreporting of deaths and cases. All models point to a really high skyrocketing of numbers. And they do take into account, in order to build a cogent model for COVID-19, you really need to model the virus transmission transmission process, the virus mutation process, no information about reinfection and cross-infection, as well as you need to know about the process of human behavior and policy. So there are too many unknowns, but this is the really curve fitting based on the latest data you have, and under some assumption that reinfections are happening, and we also are seeing that a more transmissible variant is at play.
Very, very worrying. The numbers that you're citing, 5 lakh cases a day, 3,000 to 4,000 deaths a day, possibly over the next month. Dr. Ravi, as one of the country's leading virologists, you've been tracking this double mutant. How much of is this double mutant far more virulent? Is it not even responding at times to vaccines, which is why those who've been vaccinated with the first dose, some of those are getting reinfected, Dr. Ravi?
Thanks, Rajdeep, for having me on the show. And let me make a small submission that I am following viral variants from Bangalore, not necessarily the double mutant. Having said that, the double mutant has been identified predominantly in Maharashtra, and now it is also being reported from other states as well. As regards your question on the response to vaccine, let me make it very clear that it takes 2 weeks after 2 doses for any vaccine to protect against any type of virus, be it wild type or mutant. Because the spread is extensive now, many people who have taken single dose vaccine are turning out positive. That is a fact. It is not necessarily mean that this is because they are mutants, they are causing infection in people. Even a wild type at this rate of transmission that is going on in the country will definitely infect. So that is one point I want to make it clear. I also want to make it very clear that there is this myth that if you take a shot today, tomorrow you are protected. And also remember, vaccines guarantee protection against severe disease and death, and certainly not against infection. The degree to which vaccines protect against infection varies between vaccines. Having said that, no vaccine gives 100% protection against infection. Over.
But what is the trend, Dr. Ravi, that you're noticing then as you track these various strains? I mean, are we seeing different strains in different parts of the country now? You said there's a double mutant for sure in Maharashtra. And is it far more contagious than what we saw in the first wave a year ago?
I would love to give you authentic information, but unfortunately, the double mutant in Maharashtra, we do not have authentic data to say it is more transmissible. It looks like, from the way it is taking over the original virus that was circulating before. But to say a mutant is more infectious, there's a lot more data that is required in terms of the number of people who are infected from an index case. You need cluster analysis, you need very good epidemiological data, and you also need some amount of support from cell culture studies where the virus has to be isolated and shown that it is multiplying to high levels in cell culture. Now, I'm afraid both these kind of data are not available for the double mutant. At this point, I believe it is being generated. In many other states, there are other lineages of virus that is taking over.
Can I ask you, Professor Mukherjee, the reproduction rate, the rate at which this is getting transmitted this time is well above 1.0, which is when we know that the virus is under control. Some states like Bihar now reporting 3.5 people getting infected for every 1 person who gets corona positive. Does that suggest to you that this virus, these strains, are far more infectious than in the first wave?
Yes, so that's an excellent question. And again, is the lack of data on genomic surveillance. It's hard to accurately model what is the prevalence of different mutants. But one thing I want to say is that the virus does not listen to state border patrols. So to assume that the mutant is only restricted to Maharashtra or a particular state will not be correct. And the more it spreads, the more it changes. So if we reverse engineer these R numbers, these virus incidence curves, this huge surge, even if we incorporate waning immunity, a percentage of population getting reinfected, or we actually make human COVID appropriate behavior to zero, it is very hard to reverse engineer this spike without the plausible explanation of a more transmissible virus variant.
Right. So you're saying it's more likely to be more transmissible, but do you believe that, let's say, a month from now, things could get better? Do you believe, Professor Mukherjee, that April is the worst month, but as more and more people get infected, many of them asymptomatic, some element of immunity will set in by the middle of May? Or you can't clearly say, give us a timeline?
So it's very hard to give a timeline, and I think this will be audacious of me to say that the stochastic crystal ball and models know all the answers. But what we have seen in other countries in the second wave, in terms of South Africa, UK, and US, there has been a sharp rise, but also a sharp fall. And the models are showing that Maharashtra right now, the best information we have, is coming down at the end of April, early May. And so I am hoping that something miraculous like that happens. It is very hard to say that it's more like a spike rather than a steady astronomical growth. That's all I can share with you at this point.
Okay, Dr. Ravi, what's the solution? You're saying that vaccinations are not 100% guarantee that you won't get reinfected. Therefore, according to you, what's the best solution? COVID appropriate behavior with double masking. Is that the only solution now?
Mutant or no mutant, vaccine or no vaccine, the only method that ensures protection is masking, maintaining social distancing, sanitizing, washing hands, most importantly, avoiding crowding and going to closed spaces. So I believe, in the last few days I've been telling, lockdown is an extreme step. I don't think lockdown is the solution, but governments may have to impose it. I don't know. I am not an expert on that. But I believe lock-ins are very important. All people who are aware should avoid unnecessary activities that are not going to influence their daily living. I think I would like to lock in myself. If I have to go to work, I go to work and come back and stay locked in. Lock-in is a voluntary activity that people can take up. Remember, the only way the curve will come down is when it reaches peak, people realize the importance, they change their behavior. Behavior change is the most effective vaccine. The vaccines that we are promoting now are very good to prevent a third wave. Many countries are seeing third wave. If we continue our pace of vaccination and accelerate it, we will stop the third wave or minimize the third wave.
Okay, I think we've got from Dr. Ravi and Professor Bhramar Mukherjee an overarching picture of what's happening. I wanted to start by not alarming our viewers, but telling us, and I'm glad that you've spoken so candidly, saying, look, take this very, very seriously. This could be far more contagious. The numbers thrown by Professor Mukherjee, terribly, terribly worrying. We need to lock in, as Dr. Ravi is saying. Thank you both very much for joining me here at the top of the news today.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.